Okay.
Just quickly get a book and a pen. Just like
sure.
Say 30 seconds. Yeah.
Yeah. Okay, so today we'll be looking at the very most important factor, health, right? So health, the major thing. You're seeing my screen, right?
Yeah, I am. Yeah,
okay.
I can see your screen.
Okay. So we will first look at the critical planets. Okay, critical planets. So in that, the first critical planet is Jupiter. Okay, so why Jupiter? Jupiter is Jiva, that is our life. Okay, Jupiter is life. And then another main thing is Jupiter is the only planet that protects the native against any diseases. Okay, if a person has to be healthy, should have a strong, good Jupiter. Okay. So because that is the Jiva, right? So the Jiva is our life. So it will help us, the life of the native, to live. Okay. So that's why Jupiter is very, very important. Okay. The next planet is Saturn. Why Saturn? Saturn is Ayush Karaka, right? Saturn determines our natives' longevity. Okay, so
always
every
horoscope.
It is the natural karakatva. These are all the natural karakatva of these planets. Okay, it is the same for everybody. Okay, so and then it also rules the chronic issues, incurable diseases, and things like that. Okay, so in a common man's language, if I have to see, Jupiter is the planet which helps a native to be healthy. Saturn is the planet which makes one person to not to be healthy. Okay. Okay. And then Saturn will try to pull down. Again, on what circumstances, not like blindly we are saying that, right? Under what circumstances at all. Okay. If Saturn is positive, then your native having incurable diseases, all that will be reduced. Okay. So if Saturn is negative, right, then that person having these incurable diseases, issues in longevity, all that will come into picture.
Right. But and Saturn doesn't indicate acute diseases or anything. Usually always chronic. Rather.
What do you mean by acute diseases?
So, I mean, something like, let's say someone suffers for like with a high fever for 5 days and then it goes away. You know, of
those things, you know, those are all minor things. And we are talking about, we are talking about diseases which will impact your
quality of life. Yeah.
Not only quality of life, the longevity of life.
The longevity.
Your longevity, right?
Correct.
Which impacts our longevity.
Correct. Okay.
And then, of course, if that fever keeps on coming every month,
that becomes chronic again.
That becomes chronic.
Yeah.
Right? Yeah. Somebody, let's say someone have migraine.
Yeah.
It is chronic. And there are no medicines.
Right.
Right?
Yeah.
Diabetes, blood pressure.
Correct.
All those things, right? Chronic. And there are no medicines. You have to live with it.
Live with it, yeah.
Right. So these are the two planets we have to first check. Okay. Importantly.
Yeah.
Right. And the next planet is Rahu. Basically, Rahu is again same, similar to Saturn. But in the criticality of these planets, why Rahu causes confusions in diagnosis.
Interesting. Okay.
Okay. So a patient goes to a doctor, doesn't matter which doctor the patient goes, whether it's allopathy, Ayurveda, homeopathy, naturopathy, whatever, any pathy, it doesn't matter, right? So when a person goes with health issue to a medical practitioner, medical professional, right? And then wants to get diagnosed what disease, this Rahu will create confusion. Basically confusion in the sense, your results won't be conclusive. The medical professional will not be in a position to come to a conclusion to decide, oh, this patient has this disease or that disease.
But you are suffering. Even
so you are suffering. They don't know.
Yeah.
The native will suffer.
Yeah.
See, all these things is basically is back to our karma, right? Right. Yeah. We have to suffer. If somebody has to suffer this disease during this time period, yes, they have to suffer. But all these planets, basically, it's like in your movie, right? You have all these villain characters and then his assistants, associates, and all these people, right? He will create trouble to the protagonist, right? So these people are like that. So in that aspect, these people will do their job. Okay. So Rahu, again, a positive Rahu is health, is good. But again, we are all talking about negative things, right? Health is kind of more like a negative things. Okay.
Right.
So
in some case, if Saturn is negative and then Jupiter is like, I don't know, maybe aspecting where Saturn is or something like that, then that would give mixed results. Is that something?
Right. So one thing to remember, in stellar nadi, we don't see aspect at all.
Oh, correct. Of course, we don't.
Yeah, we don't. See, that is what the confusion comes.
Yeah.
Okay. Oh, Jupiter is aspecting Saturn. What does it happen? Nobody can pinpointedly tell. Give in writing, this is what will happen. They're all only ifs and buts. For one horoscope, something will happen. And another horoscope, completely opposite thing you will see. So the aspects is very, very, inconclusive when we want to pinpoint the issue.
Correct.
That is not helping. That basically creates confusion only. Okay.
So in your experience, you have seen that the stellar nadi works perfectly for health.
Yeah, perfectly works.
Okay.
Not only health, for all the events it works.
For all, right, correct.
For all the events it works.
Yeah.
Okay. And same, Ketu is also similar to Rahu.
Yeah.
Creates confusion in diagnosis, all right? And then Ketu also indicates surgeries also.
Okay.
Surgeries also. Rahu does not does not involve surgery, but Ketu does. Okay.
Okay.
So these are the 4 critical planets. And the 5th one is Mars. If somebody has to undergo surgery, means Mars or Ketu is very, very important.
And this includes, like, for example, C-section.
C-section, anything, right? Anything.
Yeah.
Anything. If a doctor's knife has to touch the body,
correct,
then Mars and Ketu has to be there. Okay. So if somebody is getting cuts, even your kitchen while
cutting vegetables,
cooking cuts, Mars has to be there.
Interesting.
Without these planets, nothing will happen.
Yeah, that's why some people are more prone to cutting their hands and fingers.
Yeah, exactly. I mean, that is all minor thing that we ignore.
Yeah.
All right. But things happen. Okay.
Okay.
So now, Now we will see the significations of signs. So remember this whole body, human body. Okay. So you divide this human body by 12. The 12 signs or the 12 bhavas. Okay. First is head. Okay. Head is first bhava, first sign. Okay. Aries. Second is Vrishabha. Vrishabha is the neck area.
Okay.
Okay. Okay. Then third is arms, shoulder, this area. Okay. This area is 3.
And it's Mithuna.
Yeah, Mithuna. Okay. Then 4 is this area, your chest.
Got it.
That includes heart, lungs, everything.
Okay.
Okay. And then everything, breast, heart, lungs, outside, inside, everything, all this area. Okay.
Correct.
Okay. And then 4, 5 also the same thing, heart only. It's like a mixed. Okay. 4 and 5.
So Leo and Cancer are basically mixed.
Yeah. Okay. Both. Right. And then you come little down. Your bowel movement and all this area. Right. So this is 6. Okay. And then your next part is 7. This is your intestines and all that. Okay. That also, again, it is very hard to say, okay, 6 intestine and here, but it's like kind of it will be like a border. Okay.
Correct. Yeah.
Okay. And then 7. So, and then your 8 is your private parts. Okay. Inside private parts and all that.
Okay.
8. Okay. Then 9 is your thigh area, this area. Okay. This is 9. And then this is 10. 10 is from knee.
Knee. Okay.
Knee. No, this area is 10. Okay.
Right.
The 11 is this part. Below knee. Below knee to feet. And
Correct.
up to ankle is 11. 12 is your feet. Okay. So, I mean, remember, basically simple thing is, remember this human body, divide this by 12.
12 quarters, yeah.
12, right? I mean, these are all the high level thing, right? Again, I mean, inside, especially this area, there are so many parts inside.
Exactly.
Okay.
Yeah.
Where it exactly comes, so 6 or 7, there could be some confusion, whether 6 or 7, or whether it is 7 or 8, right? Those things will be there. Yeah. But at least that is the area the person could get problems. Okay. So this slide is basically the same thing I have put here. Okay. Little bit more, explanation, because that picture is, it doesn't have. In fact, I wanted to create one picture on my own, but I'm still waiting to get human, in doctor's office, you will have that human anatomy picture, right?
Yes.
Right. Yeah. Take that and then mark all these things, but I'm still unable to get a good one. I don't know where I will get that also.
I can check with my doctor friends and see if
if you can get some PDF or image file or something like that, then we can do that. One day I searched in Amazon somewhere and all that to order, in fact, I wanted to order that and then keep it at in my room. Like in the doctor's office, right?
Correct.
Right. So that's one. So this is the same thing. Okay.
Same thing.
See 7, 8, there will be like, it will be overlapping.
Correct.
It will be overlapping all that. Any doubts here?
No.
No, right? Okay.
Yeah.
Okay.
Yeah, correct. Yeah.
No, go ahead. Ask your question.
No, so since it's overlapping, right? So is this tied to a specific characteristic of the Rashi itself in terms of how they've classified?
Correct. Say, for example, let's say a 7, right? Okay. The 7, it includes kidneys and then your private parts also, sexual organs, internal, which is not visible.
Correct. Correct.
Okay, which is not visible. Say, for example, yeah, what is it called? Ovaries and all that also.
Correct.
Inside
Yeah.
your body, right? Oh, like that. So 8 is your visible private parts.
Correct.
Okay, like that. So basically, if you draw that again, you draw that line between that 7 and 8, you put it, impose on your human body, then you will see where that part internally goes. We cannot see from outside.
But internally, you can understand. Yeah.
Internally, you can understand.
Yeah. Yeah.
Right?
Okay.
Okay.
Got it.
Yeah. Same thing, heart. You will see problem with 4 and 5. It's kind of overlaps. Okay. Because heart is somewhere, it's little bit down, right? It's not exactly on top.
Yeah, it could be chest region, kind of little bit upper, lower.
Correct, upper and lower, exactly.
Yeah.
Exactly.
So,
right? So that is why like it like, touches both the areas.
Both the areas, correct.
Right? Okay, like that. So basically, I mean, we have so many parts in our body. It is very hard to say. But I mean, these parts again, which are borders, right? These bhavas. So that is what we have to remember.
And most of these parts are like associated with the behavior and characteristic of that Rashi to some extent.
Yeah. So yeah, we will see. So when you are taking this, you have to take the sign also. Okay. We will see in examples. Okay.
Right. Yeah.
We will see in example how to do it. So basically, these are all the signs and bhavas. It could be a combination. Not everybody is Mesha Lagna.
Correct. Yeah.
Right? So if somebody is Mithuna Lagna, for Mithuna Lagna people, right, your 7 and 8 is the Sagittarius and Makara.
Correct.
Dhanushu and Makara.
Then,
right? 7 and 8 for Mithuna Rasi.
Correct.
For Mithuna Lagna people. Right. But same for Mesha Lagna people, Tula and Vrishika. Correct?
Yeah.
So, but if you look at it, for Mithuna Rasi, 8 natural zodiac, Vrishika Rasi, becomes the 6th house.
Correct.
Right?
Right.
So, you should consider that the natural 8 signs characteristics also.
Correct. Okay.
Okay. The 6th is for Mithuna Rasi, Mithuna Lagna. The 6th house is Vrishika. So they will get problems in the 8th sign.
The sexual organs.
These ones also, the whole thing.
Correct.
Okay.
So in that case, for Karkataka Lagna, it would be 1, 2, 3, 4, 5, 6. Okay, so hip joints kind of.
Correct. So for Karkata, it is one sign, right? So sixth bhava is this one. This will becomes the 6th bhava. And then this becomes the 8th bhava.
8th bhava, correct.
Right? This is 8, 9, 10, 11, 12. Right? So these are the problem. I mean, again, it's a combination. We will see. Okay. Yeah. But in terms of, forget about right now, we didn't look at the actual planets or anything. We are just looking at the signs and the bhava.
Correct. Got it. Yeah.
Only the signs and the bhava. Okay. So now we will see what are all the planets signifies. Okay. So sun signifies heart. I mean, so there we saw 4th bhava, 5th bhava, heart, stomach, those things, right? But again, now we are talking about which planets are responsible for those, which part.
Correct.
Okay. So sun, heart, stomach, bones, right eye, it causes headache, baldness, irritability, fevers, burns, diseases of liver, gallbladder, they have said, but mostly it falls in Jupiter. Why I wrote this is because there is a very expert in this medical diagnosis field, Dr. K.C. Charak. Okay. So in his book, he wrote this. So I don't want to override that. He's a doctor by himself. He's a doctor by himself. He's a surgeon. And then he's a very good astrologer too. So he must have seen more.
Yeah, sorry? So that's a good combination to predict all this.
Yeah. So he's very good. Let me show. Yeah. So I don't know. Can you see this?
Yeah, I can. Yeah.
So this book. Sorry. Yeah.
Got it. Yeah. No, nice.
Is Charak. So in fact, I got this autographed.
Oh, nice.
Yeah, I met him in one of the conferences.
That is the time. India?
No, he came to US. There was one international astrology conference. So I went there. He was there. And then that is the time I decided to start my research in cancer. So I asked him, I talked to him whether he will give any tips or something like that. But he did not. On the way, he did a curveball. He asked, "Are you a doctor?" I said, "No." Then he said, "If you are not a doctor, how can you do research in medical astrology?" I said, "Okay, what can I say to that?" So, but anyways.
So your specific field of research was cancer itself?
Correct.
Okay. How to predict or how to say whether survival statistics and
whether that person will get cancer or not. If they get cancer, and will they survive or not?
Correct. Got it.
Okay, right. So next planet is Moon. Moon means, remember, the natural character. Moon is all liquids, fluid. Anything is fluid is Moon.
Moon, correct.
And Moon is mind. Okay. Brain.
So more of emotional issues.
Yeah, emotional and brain also.
Brain, correct.
Brain also. Okay.
On blood also. Okay.
Yeah, basically blood is a liquid. It's fluid.
Yeah.
Any fluid is Moon. Okay.
And just curious, like for example, all these acidity issues, right? Like what would it be more related to the sun or to the moon?
Acidity is not Moon.
It's not Moon. Okay.
It's not Moon, right? So acidity is kind of gas.
Yeah.
Correct?
Wind, maybe. Yeah.
Yeah. So it is not Moon. Okay. So next is Mars. Mars, again, head, bone marrow, bile movement, hemoglobin, the red one, right? Muscles, all that.
Yeah.
Anything related to blood disorders also.
Okay.
Okay. And then because it's a fiery planet, right? Thirst, fever, those things. And then mental aberrations, aggressiveness. Okay. Moon won't be aggressive. Mars denotes aggressiveness.
Okay.
And Mars denotes surgery.
Surgery,
yeah. Since I did not.
And that is to do more with the fact that it has emphasis on weapons or.
It doesn't matter. Anything.
Yeah.
Anything.
Okay. Yeah.
Okay. Say, for example, let's say somebody getting fire burns.
Correct.
That is 100% Mars.
Correct. Even if it's an accident.
Even if it is accident. Correct.
Yeah.
All right. So you will see so many types of accidents happen, so many types of injuries happen to people, right? Which type, how it comes, that is what all these planets will
determine. And in our stellar nadi, we would consider the planets for specifically the DBA part of.
No.
Okay.
I mean, so this is where for health we consider the natural karakatva of these planets also.
Okay. Yeah. Yeah.
Right?
Right.
Okay.
Yeah.
Next is Mercury. Mercury means the natural, what is the natural karakatva of Mercury? Is communication. Right?
Correct.
What is most important thing for communication? Your nervous system.
Yeah.
Right?
You shouldn't be scared.
Skin.
Yeah.
We all use touchscreen phones. Right? You know, it is a capacitive touch, right? You have two types, capacitive and resistive type. Resistive type is where you need to use that stylus. That was olden technology. After iPhone came, then everybody moved to capacitive touch. Right? But you see our body skin, it is so sensitive, right? No calibration, nothing is needed. Until our death, we can feel that sensitivity.
Correct.
Basically, if somebody touches, some object touches, right, it feels and then it sends the signal to the brain.
Yeah.
Right? And throat, again, see, communication. Whatever part is required for communication belongs to Mercury.
Got it. Okay. So vocal cords and stuff.
Yeah, vocal cords, lungs, you know, all that. The nervous system, you know, you know, if defective in speech, people are dumb people,
correct.
Right?
Yeah.
All that. Okay. Then again, Mercury is a unique planet, right? Unique planet, right? So importance, if somebody is having these issues, then Mercury should be connected to that.
Connected.
Okay, the sex of the planet.
Got it.
Okay. Ears, deafness. So basically, deaf and dumb, right? So all
anything
that is
to do with communication.
Yeah, anything related to communication is Mercury.
Yeah.
Jupiter, liver, important. Liver, gallbladder diseases, anything liver and then liver associated diseases. Okay. And here Jupiter also, they're saying that ear troubles. Okay. Then again, see jaundice, but basically jaundice again related to liver.
Liver, yeah.
Obesity is Jupiter.
Oh, okay.
Okay. If somebody is obese, Jupiter is the planet. Okay. So Jupiter, the natural karakatva of Jupiter is expansion.
Yeah, in positive and negative.
Yes, expansion.
Yeah.
If somebody has to be very rich, you need strong Jupiter. Jupiter is the one expands.
Correct.
Okay. And Jupiter with Rahu combination, that's it. Okay, that is positive. Negative, you will get the negative side of all that. Okay. Then it rules over flesh, you know, all that. Okay. So basically, you remember the key things, right? We are not medical doctor, right? People will come to us for every body part of the problem.
Correct.
Right?
Yeah.
All right. But they will come to us with some critical issue or a general thing, right? This is what we are going to. And we are not going to prescribe any medicine or anything based on this thing. Right? But these are all the areas the native could face problem.
Got it.
Okay. These are the areas where a native will get issues.
Yeah.
Okay. Now Venus. Venus is kidney, pancreas, retina, sperm, eggs, anything reproductive things. Venus.
Okay. But
Okay,
from a
or
female
any.
reproductive or
Sorry.
Is it from a female reproductive part or
Both,
just
both,
okay,
both,
okay,
both.
okay.
Anything related to reproductive things, right?
Okay.
Is Venus.
Okay.
Or people will get any sexual diseases, right?
Correct.
AIDS,
Yeah.
HIV, you know, all those things, again Venus.
Okay.
Okay. Basically, Venus denotes reproductive organs. Okay. Urinary system also. All that intestine, here, everything, urinary bladder, laziness, tiredness. I mean, these are all come like later, right? Laziness, tiredness, exhaustion, typhoid, appendicitis, all that. Basically, everything, all your secret, your private part area inside the body. That is Venus.
Yeah, probably even like kidney stones and
kidney stones also, yeah.
Yeah.
Kidney is number we wrote, right? First.
Number
kidney
one for
stones.
Venus.
Yeah, all these things.
Yeah.
See, none of the Venus parts are visible outside.
Correct. That's true. Yeah.
All inside, mostly inside only.
Okay. Yeah.
Now Saturn. Remember one thing, simple thing for Saturn. See, like for every planet, I'm giving you simple thing to remember. Okay. Venus is all private part, private thing, secretive, inside, right? Saturn is basically any body part which is not needed for the body.
Oh, okay.
Okay. Your hair. I mean, people can survive without hair, right?
Correct.
That is one. Yeah. Right? Your nails, dead skins, all that. Okay. Those parts grows and then we cut off, we remove it.
Correct.
Okay.
Yeah.
Right.
Yeah.
Then Saturn also responsible for bones.
Oh, okay. And including tumors and cancer. Okay.
To some extent. Because why? It is falling in chronic issues. It could lead to affect the longevity of the native.
Got it. Okay. Yeah. Makes sense.
Okay. So the tumors, what is the natural character for tumor? What it is? What is it?
Like Mars or?
No. Forget about the planet. Why tumor is caused? What is in the actual medical terms or normal common man's thing? What tumor is?
Cell change, maybe like
basically an extra growth.
Yeah, some foreign thing in the body.
Some foreign thing, some extra growth.
Yeah.
Which planet is responsible for extra growth?
Like Jupiter?
Yep.
Yeah. Okay.
Okay. The combination of Jupiter, Saturn, all these things will determine.
Okay. So usually from when you're actually looking at this cancer tumor perspective, focus on Jupiter and Saturn.
Don't worry, we will come to it.
Okay.
Okay. First, I just want to cover the basic things.
Basic things. Okay.
Okay.
Yeah, got it.
Okay.
Yeah, makes sense.
That is why Dr. Chala said you have to be a doctor, but I mean, so yeah. I'm not a doctor, so don't worry. I'm learning. So
correct.
Right. So all these parts. Anything related to waste is
colon and rectum.
Colon, rectum, all falls under Saturn. Anything you feel this is dirty.
Okay.
That is Saturn.
Saturn. Okay.
You see legs, feet, teeth,
dead skin. Yeah.
dead skin, teeth.
Correct.
People, we get so much of decay.
Yeah.
Right? All that.
Okay.
Okay. Rahu. Rahu is basically Saturn. Whatever the characteristics of Saturn applies to Rahu.
Rahu. Okay.
Okay. On top of it is it creates confusions in diagnosis. And on top of that, these other diseases, leprosy, ulcers, incurable ailments again. Okay. Poisoning, snake bite. If somebody is poisoned, right? People die with poison. People die with snake bite or scorpion. Anything related to poison and all that. That is all Rahu.
Okay.
And if Rahu and Moon joins, then people will get all sorts of phobias.
Because it plays with the mind.
Yeah.
Yeah.
Moon is mind.
Mind, yeah.
Rahu is again another giver. Expansion.
Okay.
Okay.
Yeah.
Because remember, Rahu is head, no body.
Correct.
So Rahu wants everything. Whatever it says, it wants. He wants everything.
Yeah.
So if it is positive, yeah, it is good. If it is negative, then it will same thing.
Right. So, but this does not indicate chronic ailments, or
it does
also. Okay.
It does.
Okay. So incurable ailments and okay.
Yeah.
Okay.
Ketu. Ketu is basically like Rahu only. The difference is surgery. Surgical part. Okay. And then Ketu represents Mars. How Rahu takes the characteristics of Saturn, Ketu takes the characteristics of Mars.
Okay.
Okay. Okay, clear?
Yeah.
So now we will see the Dushtanas. What are the Dushtanas?
I mean, it would be the 6th house, I think, mainly.
Yeah. 6th house. Right? 6th house represents sickness, diseases, right? All that.
Yeah.
6th house. Next is 8th house.
Yeah.
8th house, your longevity.
Correct.
Longevity, commonly people call it as house of death, right? Accidents, misfortune, rejection, disappointment, delay, defeat, all that is 8th house.
8th house, yeah.
Then what is left?
12th.
12.
Yeah.
12 is loss, impediments, right? Expenses, separation from family. Right? If somebody has to be admitted in hospital,
correct.
12th Bhava has to be there. Okay.
Okay.
All that is 12. So these 3 houses creates the issues for health.
For health. Yeah.
Okay. So now we saw the Dushtanas. Okay. Okay. There's another important combination, which normally traditional astrology, I'm not sure they do that, but in stellar nadi, we do that. Is apart from all that, 1-4-10.
Okay.
1-4-10 reduces the immunity in the body. Your treatment won't be effective. And basically, it also creates chronic issues. Okay. If
But
somebody has majority of 1, 4, 10, that means they will have chronic issues.
Chronic issues. Okay. But isn't 10 okay? So why exactly this combination? 1, 4, 10.
I don't know exactly.
Okay.
But this works wonderfully.
Wonderfully. Okay. Okay.
People in the traditional method, people say in quadrants, right? 1, 4, 7, 10, you have more planets or those bhavas are good, then they say that is a very good horoscope.
Correct.
But according to me, when we are following these things, not 7, leave that 7, right? 1, 4, 10.
1, 4, 10.
1, 4, 10 causes chronic issues. They will have chronic problems. Which type of chronic problem, to what level, that's a different part.
Right. Yeah.
Whoever have 1, 4, 10, they will have, you go and ask, talk to them. They will say, oh, I have migraine, I have back pain, I have BP, whatever, some or other.
Diabetes or something.
Some or other chronic issue, they will tell.
Correct.
Okay. It is not like, not something like at the age of 50 or 60, somebody is getting that. They will have like the moment they become adult or, teenage itself. They'll say, oh, it is there from my childhood.
Childhood days, yeah.
This problem is there from childhood days. They live with that problems. Okay. So now we saw all these negative things, right?
Correct.
Out of 12 bhavas, 6, right? 6, 8, 12, 1, 4, 10. 6 bhavas causes the issues, right? Then what are the bhavas are going to save us?
11.
Okay.
Then I guess 2 and 3 also.
2 and 3 also. Why?
2 is about like gains and okay, I can't relate it with respect to health.
Okay.
Oh, 5, 9, 11. Okay. I saw that.
5, 9, 11.
Yeah. So, okay, correct. 5 is 5. Okay.
5, 9, and 11. These 3 bhavas are very, very important to recover.
To recover. Yeah.
To recover. See, 6, 8, 12 will cause diseases. Okay. 1, 4, 10 will tell whether it's going to be a chronic nature or a temporary.
Recover. Okay.
Recoverable. Then this 5, 9, 11 will tell whether the native will recover or not.
Okay. In case of you having 1, 4, 10 plus 5, 9, 11, both combination in the same, this one, which would be more powerful in terms of?
All are powerful.
Okay.
We have seen, right? So if the planet has that combination, all will be powerful.
All will be correct.
What does it mean?
Mixed.
Mixed. Okay. What do you say by mixed?
I mean, it reduces, you get chronic issues, but you slowly recover or something like that. Or
basically, with the medication, your issue will be controlled.
Correct. You're managing it instead of
managing it.
Correct.
That will not become a fatal.
Got it. Just like diabetes and BP, you take
correct.
tablets.
Diabetes and then blood pressure.
Lifestyle
let's
changes.
take migraine. It's a simple example.
Yeah.
So many people have migraine.
Correct.
What do they do for migraine?
They take painkillers.
Painkiller. That's all.
Correct. Yeah.
So with the 5, 9, 11, that means there is medicine. That is the key part.
Got it.
To control that disease, there is a medicine.
Right. It's not
if
like
there is no 5, 9, 11, There is no medicine for that patient.
Right.
That is where the native surviving will become a question mark.
Question mark. There is no treatment options.
There is no treatment.
Yeah.
Even if there is a treatment, it won't work for that patient.
Right.
Doctor will do the same thing.
For some it works and for some it doesn't, which is why
it won't work.
Yeah.
Right? Okay.
Mm.
So now we'll see other combinations. Okay. 16, 18 or 112, that means minor health issues. Okay. In majority of planets, you have this 1, 4, 10, not only the chronic thing, again, depending on the time period, right? If they are young, they're planning for children, then that denotes less sperm count, okay, or less eggs in females. Okay.
Yeah.
Or medicine will be ineffective. That comes in the later stage, right? And then again, it's a deadly disease also, right? Again, it depends on other combinations.
Okay.
Right?
Yeah.
Okay. So for surgery, 1, 6, and 8. 1, 6, 12 also chronic. Basically, the difference between these two is 1, 6, 12 is, I mean, I shouldn't say chronic. It should be like continuous, one after another problem they will get.
Okay.
They will keep visiting hospital.
Got it. Yeah. There's
always
expenditure.
Yeah, exactly.
Yeah.
6 and 12, right? So they keep on getting health issues.
Okay.
If one goes and next week they will say, I got something else, my stomach pain. Then after that goes, they will say headache. Or the other things, my leg pain or my back pain. Not like that. They keep on getting issues.
Yeah.
Okay.
Okay.
Then if you see this 1, 6, 12 or 1, 6, 8, 12, in this combination, if a person undergoes a surgery, that surgery will not be successful. Basically, what I mean by not successful is, why are we trying to do the surgery? To remove,
get rid of the issue. Yeah.
You get the issue. That issue will remain.
Okay.
Okay. So the best time one has to do surgery is 1, 6, 8. Not 1, 6, 12 or 1, 6, 8, 12.
Got it. Yeah. Yeah.
Okay. Then 1, 4, 8, 12 and Rahu Ketu in DBA denotes accident.
So Rahu Ketu responsible for the accident.
Yes, Rahu Ketu is responsible for accidents. Okay. Without Rahu Ketu, no accident.
Okay. Okay.
Okay. Then 1, 4, 6, 8, 12 plus Rahu Ketu, that means accident and injury.
6 also is involved. Okay.
Yeah, 6 is involved, right? Then again, see here 1, 6, 8, 12, all that means injuries. Then Rahu Ketu, if Ketu is there, then surgery also will be there. Okay. Ketu or Mars, then surgery will be there.
Okay.
Okay.
Yeah.
2, 1, 6, 8, depression. Somebody is having depression.
Okay.
Okay. Again, not just one planet, majority of the planets. Especially if Moon has this 1, 2, 6, 8, and then it also has 12. That means those people are very, very sensitive, very, very, they must be going through a lot of depression, that situation.
Right. Even this bipolar and stuff.
Yeah.
Classifiers. Okay.
All that, right? I mean, this is, see, If I have to put that, then I have to put the whole our medical MBBS course. All right.
Yeah.
So this is basically the basic things I'm touching, right? With that, you have to extrapolate.
Correct. It's
the combination, right?
Yeah, combination. Yeah.
The combination, the mix and match, combinations and permutations and combination, what is causes. Okay.
Correct.
Somebody is very sentimental, means moon, or if moon in ascendant, that means they are sentimental. Okay.
Right.
And
along with the ascendant. Yeah.
In the ascendant. Then if the ascendant itself is Cancer, then it is very high.
Yeah.
Scorpio Pisces is also sentimental, but not like this Cancer people.
I can vouch for that.
All right. But if moon is sitting in Cancer, and that becomes the Lagna,
then even more.
Very, very sentimental.
Right.
So, okay, very, very sentimental. If moon is in Scorpio, again, sentimental only. Okay.
Yeah.
So natural. Say, for example, Narendra Modi has moon in Scorpio.
Oh, okay.
Yeah. External world, we might think he's very, non-sentimental, but he's very, very sentimental. If you, I mean, people who are closer to him will know.
Exactly. Yeah.
Are you right?
Yeah.
Then hallucinations, moon Saturn, moon Rahu with 6, 8, 12 combination. See, anything related to mind, moon has to be there. Okay.
So you're saying Saturn and moon both should have that. Saturn, moon, and Rahu, all three should have that 6, 8.
No. Two separate combinations.
Okay.
If Saturn and moon with both having 6, 8, 12, then also hallucinations. Moon and Rahu, 6, 8, 12, also hallucination.
Okay. Oh, got it.
Like that.
Yeah.
Okay. Then
I had a friend yesterday. She was, I think last week she was telling me that she keeps seeing snakes in her dreams. And I mean, I don't know if that classifies as hallucination, but when I checked her chart, she also had a lot of 6, 8, 12s.
Okay. Let's do that, right? You let's check today itself.
Correct.
Yeah. Let's see the. You just keep the birth details ready. We will do that.
Yeah.
Okay. We will see that. Right?
Yep.
Say if moon, okay, we will see. And so then again, 6, 8, 12 in Rahu, and then Rahu in DBA means there is a chance that they will get impacted by black magic.
Oh, okay.
Okay.
So okay, Stella Nadi can also predict who gets impacted by.
Yeah, but again, we cannot 100% say that. But again, yes, we can predict to some extent.
To some extent.
To some extent.
Okay.
Yeah. Okay. Okay. So now the part. Any doubts? Any questions so far?
No, I think it's pretty clear till here.
Pretty clear, right?
Yeah.
Okay. Okay, right. So now we'll see how to do the reading, how to analyze the chart from health perspective. Okay. First, we have to check the Lagna. What type of Lagna is, right?
Okay.
Then take the Lagna Lord. Who is the Lagna Lord?
Okay.
Okay. Then planets in Lagna. Ascendant.
Okay.
Why ascendant we are talking?
Because that is self.
That is self. That is our body. Lagna is the body.
Yeah.
Health is for the body, not for the Atma. Right?
Correct.
Right? So it is for the body. Body is Lagna. Okay. So basically, Lagna type, then you
Ascendant
check
Lord.
the ascendant Lord, planet sitting in the ascendant.
Okay.
Then, when you do the stellar nadi calculations, right, you count the each bhava, how many times it is occurring.
Correct.
Okay?
Yeah.
Right?
Yeah.
1, how many times, 2, how many times, 3, how many times, 4, like that, 1 to 12.
Okay. Mine 6 is like the most.
Yeah. Right. So
Yeah.
see that how many times each bhava is coming.
Repeating.
Right.
Yeah.
And then take that bhavas. Okay.
Okay.
So if it is 5, right? So then take that 5, see which is the 5th bhava in your chart. And take the bhava lord of that bhava lord and planets placed in that bhava.
Okay.
If the 5 is more in somebody's horoscope, let's say it is coming as 20 times, okay, then go and check the 5th house in that horoscope and see the 5th lord.
Correct.
And see the planets occupied in that 5th house.
Okay.
Okay.
Yeah.
I'm just giving an example. It could be for everything, right?
Yeah.
And then now you check the signification of that bhava and planet. See, now we took 5th bhava, right? Whatever the body part is 5th bhava. What are those?
Fifth bhava is usually like the heart and lungs kind of a.
Correct. No, not lungs, heart.
Not heart, not lungs. Yeah, heart.
Yeah, heart. Heart comes from both 4 and 5.
Yeah. Okay.
Right.
Yeah.
Lungs and all this part, right?
Yeah.
And then planet sitting there. Let us assume planet is sun. Then what happens? In that 5th house, let's say 5th lord is sun, or on the sun is occupying 5th house. What can you deduce?
So, like whatever sun is responsible for like the heart, stomach.
Correct. Exactly,
region.
right? So 5 is heart and planet responsible for heart is sun.
Yeah.
That is connected. So that means that native will surely get heart related problems.
Oh, okay. Okay. Interesting.
Understand?
Yeah. And you took sun because that if that's the like the Bhava Lord or
Bhava Lord or planet placed in that
Bhava. Correct.
Okay.
Okay. Okay. Yeah.
So then check planets placed in 6, 8, and 12 houses. Okay.
Yeah.
Apart from this, what are the planets placed in these bhavas? Right?
Okay.
And then finally, when the native will get problem. Okay, I've seen, okay, sun, we saw 5th bhava, okay, heart problem. What is his DBA currently looking at? If the native goes through that DBA, then he or she will get that problem.
So you could predict like the timing of, let's
timing
say, a heart attack
of when the person will fall sick.
Fall sick, yeah. Even if it is a heart attack or something like that.
Yeah. I mean, one thing remember, okay? Don't ever predict when that person is going to get this type of things.
Correct, yeah. Unless
heart attack.
Yeah.
Okay. Yeah. Don't ever do that. Even if you do it, you feel that, oh, this person, this time period, he or she might get heart attack or something like that, right?
Yeah.
By telling that itself, will create problem to the native.
They'll have fear factor and everything.
They have the fear factor.
Exactly.
Okay, then we will become another tool for them to get in the heart attack.
That's true. Yeah, that's a bad thing.
So don't, like how in career predictions, we'll say, okay, in this time period, you will see rise, promotion and all. That is on, people will take it.
Happily, yeah.
Yeah, happily, or we'll say, okay, this time period, there could be your job loss or your business loss and all. That also people will take it.
Correct.
But when if you say this time period, you will get a heart attack, people will not take it lightly.
Of course, yeah.
Okay, so that becomes very sensitive thing.
Correct.
So don't ever predict any major health related issues and then convey that to the native.
Correct. Okay.
You sugarcoat it even if the native specifically asked. Okay.
Right.
Okay. Can you tell me if will I get a heart attack or not? Right. Then you, based on the DBA, you say, okay, that time period, you be careful.
Yeah, but you can't clearly say you will.
You will or, yeah, we cannot clearly say that itself will create problem.
Correct.
Okay.
Yeah.
You see all these things, right? So then basically you have to sugarcoat as much sugarcoating as possible, especially when it comes to health.
Yeah, that's true.
All other aspects, people will take it, no problem.
Yeah, possibly even longevity, right? In an extended sense.
Yeah, that is next chapter is longevity. Then we will we will talk in that, right?
Yeah, correct.
So then check the DBA and what to do with that.
Yeah.
Okay.
Yeah, got it.
Clear?
Yeah.
Okay, so now let's take this example. Okay, so this person, let's see, what is the maximum count? Okay, let's say for what is the Lagna?
Gemini.
Gemini, right? Yeah. Okay, Lagna Lord. Mercury.
Mercury, yeah.
Mercury, right? Yeah. So, okay, so Mercury is here, right? And then what is the next one where we need to see how is Mercury placed? Right? Check the Mercury. Does it have 6, 8, 12 or how is it in terms of?
It has 8, 12 and 1, 4.
1, 4.
Yeah.
Right?
Yeah. But also 5, 9. Yeah.
5, 9.
Yeah.
What does it mean?
Recovery.
Recovery, right? Yeah. I mean, he will fall sick. He has some, he does not have 1, 4, 10, but based on the Lagna, 5, 9 is also, it's mixed. So basically he will fall sick. He might get chronic issues, right? But because full 1, 4, 10 is not there, only 1, 4 is there.
So right? Even if 1, 4 is there, you can say that some
partially, yeah.
Partially, okay.
Partially, right? It's meeting partially.
Yeah.
All right. And then, so what is the next thing we have to check? You have to check the maximum count.
Correct.
Which Bhava?
4th Bhava.
4th Bhava. Yeah. See, 4 is 18 times. Right?
18 times.
18 times. So next what we have to see?
What 4th represents.
What the 4th represents. Yeah. What does 4 represent here?
Again, what planet? Heart.
Sorry?
Heart.
Heart.
Yeah.
Heart, right? 4 is heart. Heart, lungs, all that. Right? And then what planets are sitting in 4th house?
Okay, so lots of planets. Sun, Saturn, Ketu.
Okay.
Yeah.
Sun, see the critical part?
That's heart.
4 is heart.
Sun is also
heart.
Correct.
And Saturn in Ketu also, right?
Right.
So now the next part, the next thing is 6, 8, and 12. What planets are occupied? Have occupied 6, 8, and 12?
I don't see that full 6, 8, 12.
No. First, Which planet is there in 6th house?
Oh, which planet is there? Okay. Mars is there.
Mars is there, right? 8.
Moon.
Moon, right? 12.
Nothing.
Nothing, right? Nothing.
Yeah.
But again, we have to see the lords of those houses also. Okay. The lords of Lord of 6th house. Who is Lord of 6th house?
Libra.
No, 6th house.
Lord of 6th house. 1 second. Scorpio, right?
Correct, Scorpio.
Yeah,
Who is the Lord?
Scorpio Lord is. I have to keep referring my notes sometimes.
No problem.
I mean, where is it? Is it Jupiter?
No, Mars.
Oh, Mars. Yeah, correct.
Right?
Yeah.
See, simple thing, right? So I told you. Guru, Kuja, Shukra, Buddha.
Correct. Yeah.
Guru, Kuja means Mars, right?
Mars.
Guru, Kuja, Shukra, Buddha.
Both sides Mars and both sides.
Yeah, Guru, Kuja, Shukra, Buddha.
Yes.
And this is Chandra, Surya.
Yeah.
Shani,
correct.
that's it.
Yeah.
You can easily memorize like this.
Yeah.
In the South Indian chart.
Yeah.
Okay. So Mars. So the Lord of the 6th house itself is sitting in the 6th house.
6th house.
Okay. Right? Then 8th house.
Capricorn.
Who is the Lord?
Saturn,
right?
Yeah.
So again, where the Saturn is sitting?
Saturn is in 4th house.
4th house. But again, what is it? We saw 4th house has the maximum count.
Yes.
Right?
Yeah.
So again, Saturn is kind of doubly connected.
Correct.
Right? And who is the Lord of the 12th house?
12th house is Venus.
So Venus is sitting in
3rd house.
So Venus is fine, kind of.
Yeah.
Right?
So technically, what you're saying is there should be some relationship between 6th, 8th, 12th Lord with 6, 8, 12 houses.
Correct.
Or with the planets, like
with
sun
the planets, Bhavas, right? So this is one aspect. Okay. Right? So now with this connection, with this way, we can see, okay, these are all the, if you just go by 6, 8, and 12, you will be predicting only Mars-related issues, Moon-related issues, Saturn-related issues, because the Lord of the 8th house is Saturn and Lord of the 12th house is Venus. Okay. But there is no heart.
Correct.
But this native has heart problem.
So stellar Nadi is better here.
Exactly. Exactly. Has a heart problem. Okay. So that is one. So now we have to see how many planets have on 6, 8, 12.
Correct. Yeah.
Right. So let's see Ketu. How is Ketu?
Ketu is good because it has 1, 4, but it doesn't have 6, 8, 12. It just has 8. Yeah.
Just 8. So it is kind of a better.
In general, it's positive, right?
Yeah. I won't say positive because 1, 4 is there. Right? Okay. It's kind of neutral.
Okay.
Type. Yeah. Okay type. Venus.
Venus is there's 8, 12, but also 5, 9.
5, 9. It is mixed. Okay. So this 8, this 9 will get cancelled. This will get cancelled. This and this will get cancelled. So it becomes 0.
Yeah.
Right. And then Sun.
You can say negative, I guess, because 1, 4.
Except 1, 4, but there is no 6, 8, 12.
Right? There's no 6, 8, 12. Yeah.
So it is fine.
Neutral. Yeah.
It is kind of neutral. Right.
Yeah.
So this is neutral. Moon.
6, 8 is there. 4, 10 is there.
Right.
9 is there. That's all. Yeah.
And 11 also is there.
11 also.
Got the 11, right?
Yeah.
It is mixed.
Yeah.
right? It is mixed.
Mm.
410 is there, 6-8 is there, and 9-11, 9 is there.
Correct.
So it's kind of, he will survive.
Yeah. Yeah.
Mars.
Again, 6-8 combination. 11 is there. 9-11 is there.
9-11 is there.
Yeah.
So again, it's kind of
positive, I guess.
Yeah, neutral or mixed.
Mixed, yeah.
Right?
Yeah.
Rahu.
8 is there. 8 is there, but also 4-9. Okay, 4-10 is there.
Right.
Yeah.
It's again mixed.
9 is there. Yeah.
Mixed, right?
Yeah.
Basically, just cancel.
Cancel. Yeah.
Right?
Yeah.
Right? So like that. So then Jupiter.
6 is there. Okay. 10, 11 is there. 9. I think it's also mixed.
No, this is positive. See,
That
there
is
is only
positive,
1,
yeah.
6.
Oh, correct. Yeah. So that's a good thing. If one.
Good thing. Remember one.
Yeah.
Always single bad house is positive only.
Positive. Correct. Correct. Yeah.
This is
positive.
Saturn.
8 is there. That's all. 4-10 is there. Yeah, and 9 is there, but probably mixed again.
Mixed,
because,
right?
Yeah, 4-10 is there.
Mercury.
Mercury 1-4 is there. 8-12 is there. So probably negative. 5-9 is also there. Yeah.
Yeah, 5-9. This is cancelled. This is cancelled. This is cancelled, right? Right. So it's kind of
mixed again.
Mixed only.
Yeah.
So what is the first thing I said in the health? Which planet is the most important one?
Jupiter.
Jupiter. Why?
Because it's lot of, like immunity.
No, Jiva. Jiva.
Right?
Yeah. Jiva. Right?
Yeah.
So for this person, Jupiter is positive. That means what? He will survive.
He will survive.
And next, the trouble creator.
Saturn.
Hurdles. Saturn. How is Saturn?
Again, mixed. So
mixed. So that means the trouble creator planet is mixed, not bad, not good.
Yeah.
The savior, Jupiter, is positive.
Correct.
That means this native will survive health issues. That is first number one.
Okay.
Right? Then we see all these things.
Right.
Here also, we are not seeing very big, bad, negative things. There is no planet saying 100% negative.
Exactly.
Right? There are no planet which has 6-8-12. There's not even a single planet.
Right. So that is the main factor, right? Just 6-8-12 in one.
Right?
Correct.
So majority of the houses does not have 6-8-12. That is number one. The Jiva, the Jupiter is positive. Number two. Saturn is mixed.
Yeah.
So all these three things are good. So this person will have good health or good life. I mean, he will have health problems. There's no doubt about it. But it won't be fatal.
Got it.
Okay.
Yeah.
For this patient, for this person, doctor has told him more than 20 years ago to undergo heart surgery.
Okay.
Okay.
Yeah.
More than 20 years, maybe
more
25 years.
Okay.
I don't know.
Okay.
But definitely more than 22 years, more than 22 years. Okay. Till now, he has not undergone that surgery.
And he's still there. He's
still there.
Yeah. Okay. Yeah, I think
he
we
may
can
be taking some medicines for heart. I don't know.
He may be managing it, but he's fine. Yeah.
To undergo heart surgery.
Okay.
But he did not. But he underwent another one critical issue. Okay. He had blood clot
Okay.
on head.
Okay.
Okay. What are the planets we saw for blood head?
Moon is one because blood is there. Same again. Head is also moon, I guess.
Yeah. Right. Brain.
Mostly.
See here, moon is sitting in the 8th house.
Oh, okay. Okay.
Okay. I don't know the exact year and month. Right. So he started feeling dizzy. He went to the doctor. Then they did, scan and all. They said, oh, there is a blood clot. Then they were all surprised. How are you able to come to the hospital? They asked, did anybody accompany? He said, no, I came alone. And he is worked fine. And he said, how did you come? We have to do the surgery immediately. They were surprised. They were shocked to see him alive.
Wow. Okay.
Okay. So he underwent the surgery and he is fine.
And surgery would be, you said Mars, right? Not
Mars and Ketu.
Ketu also.
Mars and Ketu period.
Yeah.
So I don't know the DBA. I mean, I don't know the time.
So that you would see the DBA, basically.
That we will see the DBA.
Okay.
Right?
Got it.
Right? But again, by looking at this overall horoscope, right, we can confirmly tell no issues. I mean, no issues in the sense he will survive.
He'll survive. Yeah.
Okay.
Got it. Yeah.
Okay. Let's go to next.
I like the fact that there are like pinpointed rules that you follow to predict all this. Like look at the ascendant lord and then check the repeatability and
yeah. So in Parashari method, right? If you see Parashari method, you cannot predict that this person will have a heart problem.
Right. Yeah.
Sun is nowhere connected.
Correct. Yeah. And that too, it's in the 4th house, which is not related. Yeah.
Correct. Right?
Yeah.
But that was the problem. That was the first problem he faced. This blood clot happened like maybe 2 years ago or 3 years ago.
Right.
Or 5 years ago. I don't know.
Could be age related also since he's like 1950 born. Right?
Yeah. I mean, blood clot, I don't think it will come age wise, but
it may happen to anyone. Yeah.
Yeah, it may happen to him.
Yeah.
Right?
Yeah.
Okay, right. Any questions in this horoscope?
No, I think I'm clear.
Clear, right. Okay. Yeah. Let's see another one.
Yeah.
Okay. Now, let's see. First, Jupiter. Let's check Jiva. How is Jupiter?
Jupiter is there. So let's check Jupiter as in look at the combination for Jupiter.
The combination, whether it's positive or negative.
It looks positive.
Positive.
Yeah.
It is positive.
Yeah.
Okay. And another combination I have seen even in medical thing, right? This is again my finding. Okay. When you see 10-11, that is also equally powerful like 5-9-11 to overcome the disease.
In terms of health, yeah.
In terms of health.
Okay.
Also, okay. So Jupiter is positive. How is Saturn?
Saturn, 8-12, mixed, I guess, or probably a little negative. Yeah.
You don't, it's negative, but not that negative. Only 8-12.
Correct.
There's 1-5 is there.
Yeah.
So this 8 will go.
So just 12 remaining.
Only 1-12 is there.
Yeah.
Still it is negative, but not that bad negative.
Not that bad. Yeah.
Okay. Right. Now let's see all the 9 planets.
Yeah.
How is Ketu?
Ketu is positive.
How positive?
So 5 is there.
Okay.
10. Okay,
10.
110 is there. So I actually a little negative.
Yeah, okay. See, okay, 112 is there, right? Just 12. There is no bad 6 and 8. Okay.
But yeah, and one positive, one
positive.
negative house.
So it is positive. We can take it as positive only.
Positive itself, yeah.
Okay.
Yeah.
Then Venus.
Positive again, because nothing is there.
Nothing is right.
Yeah.
Positive.
Yeah.
Sun.
Positive again.
Positive.
Yeah.
Moon.
Positive again, because yeah, only 1 6.
Yeah. Mars.
Positive.
Rahu.
Positive again. In spite of 1 4, it's fine, right? Like
yeah. I mean, 1 4 is basically chronic type of issues.
Okay. Yeah.
With this we saw Mercury.
6 8 is there. 10 11 is there. 5 is
11 is there, right?
Probably like positive only.
Positive only.
Yeah.
Small positive.
Yeah.
Okay. So then what is the next thing you have to check?
Ascendant.
Ascendant. What is ascendant?
Aquarius.
Aquarius. Who is the Lord?
Saturn.
Saturn.
Yeah.
So what is Saturn denoting?
Negative.
Negative.
Yeah.
Right?
Yeah.
So that means what?
That Saturn related issues could.
Saturn related issues. Yeah. And then overall health. What will you say? The person will say, is coming to you and say, okay, tell me how is my overall health, in my lifetime.
I mean, there are problems, but nothing major, I guess, because Jupiter is again positive.
Jupiter again is positive, right?
Yeah.
But the Saturn is negative.
Right.
The, Aish Karaka is negative, right?
Right.
And is the Lagna Lord itself, right? And is negative, but it's not that bad negative.
Correct.
So in one line, this person will have health issues, but he will survive.
Right.
He will lead the life with managing the health issues.
Correct.
Okay.
Right.
Okay, right. So now let us see. I will tell you the problems this person has. Number 1. He developed psoriasis.
So that is skin.
Skin.
Yeah. So has Saturn again.
No, skin is what?
No, not Saturn. Sorry.
What does skin do?
Venus.
No, what does skin do?
Protects your body.
No, protects, right? Another main thing is sensitivity, right?
Sensitivity, yeah.
So what is sensitivity? Communication.
Mercury. Yeah.
Okay.
Yeah.
See, what is the 6th house? 6th house.
Here? Okay.
In this chart, what planets are there?
Saturn is in the 6th house.
6th house. Saturn is there in the 6th house, right?
Yeah.
And who is the Lord of the 6th house?
Okay. Moon.
Moon. So moon, right? Okay. Then what is 8th house?
8th will be Virgo again. Mercury.
Mercury, right?
Yeah.
Okay. No planet here. So Mercury. And who is the 12th Lord?
12 is Saturn again.
Saturn again, right?
Yeah.
Saturn. So Saturn. So basically you see Saturn is well connected for this horoscope.
Correct.
Right?
Yeah.
And then 8th Lord is Mercury. Again, 8th house is what?
Ayush.
No, not only Ayush. It also responsible for chronic problem.
Correct.
Chronic problem, right?
Yeah.
So, and then you see Mercury. How is Mercury? Mercury
slightly positive.
Is positive, right?
Yeah.
So 6 and 8 is that it is not well connected.
Correct.
Okay. It's not well connected. So he got the issue of psoriasis, but he is able to manage
it.
He's managing psoriasis for the past maybe 25 years.
Okay. So he technically got an issue related to Mercury. Okay.
Then maybe 30 years. I don't know. Okay. Maybe 25, 30 years. I don't know. Okay. See how astrology works. Okay. He got the psoriasis. He got a peculiar type of psoriasis that is, I don't know the exact, I don't recollect or I don't remember that exact medical term. That psoriasis affects the bones also.
Okay.
Not just the skin, it affects the bones,
also.
Bones also. Say, for example, his hand, right? This middle finger is the tallest, right? This is the biggest, longest finger for everybody, right? Those bones have shrunk. This has become like this.
Okay. Yeah.
These fingers have shrunk.
Okay.
Basically, he cannot lift even one full glass of water.
Okay.
Who is responsible for bone?
Mercury again.
No.
Okay. Oh, sorry.
Saturn.
Yeah.
Saturn, right?
Yeah.
So 6th house.
Oh, so
and
anything that is represented
and the
by
Lagna Lord.
Yeah.
Everything.
Yeah. Technically, does Saturn represent skin also or just...
No, bones.
Only bones. Hair, bones.
Nails, hair.
Yeah.
Rectum.
Got
all
it.
that.
Got it.
All that.
Yeah.
Okay.
So he was associated with both Saturn and Mercury disease.
Mercury.
Right.
Okay.
Yeah. And moon is positive, I guess.
And moon is positive.
Yeah.
So that is why, because of so many planets are positive, he is surviving.
Right.
Okay.
Yeah.
So another part. Which house is maximum repeated?
7th house.
7th house. Yeah. And just pick top 3.
Okay. So 7th, 10 and 5.
5, right? So because these numbers will vary, because the moment we change the birth time, right? I mean, few minutes before and after, this Bhava calculations will change. Okay. So that's why it's always better you take the top 3. Okay. Unless you see a drastic, like in the previous horoscope, you saw one Bhava is standing up.
Yeah.
Like 18, 20, like that, right?
Correct.
If you see that 18, 20, 25, then it stands out. No matter what you do, it will be the same. Okay.
Correct.
So these things, like, it could change.
Okay. It could change.
It could change.
Yeah.
Right. So basically, 10 is again thigh part, right? Legs, right? Until joints, right?
Right.
And then 7 is again internal body parts, right? The intestines and all those things.
Yeah.
Maybe he has issues, and I'm not aware of that. Okay.
Correct.
The highlighted one issue I'm aware of it is 5th Bhava. What is 5th Bhava again?
Again, heart,
right?
Yeah.
He had I don't know whether he got heart attack or he has stent.
Okay, so some heart issue.
Surgery was done and then some stent was put or something like that.
Okay.
So that is also, again, we can see that.
So even if things are positive, there are chances that people can get chronic ailments, but they'll survive it.
Exactly.
Yeah. So,
see, the most important thing is how many planets are positive.
How many? Yeah.
Right? In this horoscope, majority of the planets are positive.
Positive, yeah.
So he will survive.
He will survive. Whatever happens.
Whatever happens.
Yeah.
Okay, whatever happens. He is being sick. for last 25 years and 6, the chronic psoriasis, this, that, and all, right? He's surviving. His cousin, same age, maybe a few months difference, maybe 1 year difference maximum, not more than that. Okay. That person is very jovial, enjoys the life. Okay. Like he, completely freak out. He doesn't care about family issues, this, that, and all. He will say, what family issues? That's why you enjoy, man. Like that type of a nature. Okay. He wants to live happily. Always he will be smiling, he will be enjoying, he will watch movies, he will do all sorts of things. Okay. Enjoy. Right? Guess what? He died before him with heart attack.
Past karmas then.
Yeah, except so basically, I mean, that person is very healthy person. He never had any health issue at all.
Yeah, I mean, if you see that, a lot of people, right, like actors and sports people who die because of, I mean, you can't say they're not healthy because they're sports person, they should be healthy.
Correct.
But they still
so
have
basically, heart attack means what people think, somebody, okay, you put more stress, more that person never takes any stress at all. Right? I mean, age related, I don't know, maybe 65, 70 years, close to 70, maybe plus, maybe 68 or whatever. I don't remember exactly.
Yeah.
He had some heart pain, he said, chest pain. They took him to the, hospital. And on the way to the hospital, he died. They went to one doctor, then the doctor said, you go to another doctor. That doctor said, take him to the hospital. Then he passed away.
Yeah. So he would not have imagined the previous day that he would.
Exactly.
Yeah.
Right. I mean, I don't have that person's horoscope.
Yeah.
But, no, I came to know about this. Right. So this is how you see the surviving.
Yeah. So suffering necessarily does not equal to people losing longevity or anything.
Exactly.
That's one thing. Yeah.
Exactly.
Yeah.
Right. Yeah. So with this, in this stellar nadi, we can see her. With this, we can clearly tell. In spite of so many issues, this person is still surviving, and then he's managing. He's happy. I mean, happy in the sense, he's doing his work. He does business. He has a shop. He will sit in shop. He does business and all.
He's surviving.
But he cannot lift anything. But he does whatever he can.
Yeah, exactly.
To keep the business up and running.
Correct.
Right. So that's the thing. Okay. So what's the time now?
7:42.
7:42. Okay. Yeah. I think that part, the cancer part, we will take next week.
Next week, yeah.
Because if I start that, then that will take a little bit longer.
Yeah. Okay. I do have horoscopes of people who have suffered health issues. Maybe
we wanted to discuss that one person, right?
Yeah. I mean, more than one person. There is this person I know who, like one of my relatives, she has been suffering from one after the other chronic issues for the last 25 years.
Wow.
So, but she's happy and she's like surviving, that.
Okay.
But she had a lot of health issues, like 4 or 5 chronic ailments going on.
Okay. Yeah. Let's do that. 1 minute. Let me share my screen.
Sure.
Okay, you are able to see my screen, right?
Yeah.
Okay. So I'll say Manas.
Chronic relative. Yeah.
Health. That's okay. I don't need their name and all that.
Okay. Yeah.
Chronic health issues, right?
Yeah.
Okay. Is there any body part or anything?
Specifically, a lot of issues with diabetes.
Diabetes, right?
Yeah. Like diagnosed with diabetes at the age of 29 or something.
Oh, okay.
She is now 50. So
early diabetes. Okay. Tell me the date.
So it's 5th June 1972.
5th June 1972.
11:47 p.m. Bangalore.
Bangalore. Okay. Okay, so
yeah, so this is her. I think this is correct. Yeah, Aquarius ascendant and Pisces.
Okay, right.
So the BP was at the age of 21 itself.
Wow. BP at the age of 21. 21 means 1972 born will be in 1993, approximately 1993.
Yeah.
Right. This one, 29 means 2001.
2001, yeah.
2001. Okay. So, see. Okay. So now let's see.
And now she has like that diabetic neuropathy and all starting up because her sugars are never under control.
Okay.
So,
yeah. Okay. Yeah. Okay. So let's see. Okay, right. So what is the first planet we have to see?
Jupiter.
Jupiter. How is Jupiter?
Bad.
Bad, right? Right.
Yeah.
Then what is the next one?
Saturn.
Saturn. How is Saturn?
Again, negative.
Negative, right?
Yeah.
Okay.
Yeah.
So now let's see all the Bhavas, right?
Jupiter, Saturn only gave away most of them.
Sorry?
Jupiter, Saturn only gave away, I think.
Yeah.
Yeah.
Ketu.
Right. Ketu is, again, you can say negative.
Negative, right? Okay. Yeah. Venus.
I mean, positive.
5, 9, 5. Yeah. 9, 5, 9, 11 is that. It is positive. Yeah. It is positive. Sun.
Positive.
Positive one. Yeah. Because there is only 1, 6. There is no 8 and 12.
Yeah.
Moon.
6, 12 is there.
6, 12 is there.
10, 11 is there. 5 is there. 1, 4. Okay.
1, 4, 10 is there.
Yeah. Yeah.
All are there. Kind of mixed.
Mixed. Okay. Yeah.
Right. And then Mars.
12 is there, but okay. 1, 4, 10 is there. 5 is there. I guess mixed again.
Mixed, right? Yeah. Mars 5, 11, 12, only 12. I would take it as towards positive.
Towards positive. Okay.
Yeah, because remember 10, 11.
10, 11, yeah.
10, 11 is my finding, okay? Not so 10, 11 helps. But again, 1, 4 is also there.
1, 4, 10 is
also there, right? So chronic thing it shows, right?
Yeah.
Then Rahu.
Rahu is 12 is there. 5 is there. 10 is there. 1, 4, 10 is there. I think
1, 4, 10 is there, right?
Yeah, negative. Okay.
Then Jupiter.
Negative.
Negative. Oh, with this 2, we saw already negative. Yeah. So this is?
Saturn is also negative.
Saturn negative, Mercury.
Mercury, 6, 8 is there. I think again negative.
Negative only, right? Okay. Yeah. So this is, we saw this Sripati. Just confirm one. See, again, we don't know the birth time. So let's check plus CDS. Anything changes? Nothing much changed. 5, 6, 8, 12 is there. 6, 8, 12, 6, 8, 12. Everything is same. All right. Okay. So then, okay. So that's fine. So it's kind of same thing. So overall, what do you say?
Definitely a lot of health issues.
Lot of health issues, right? Yeah. We see 1, 4, 1, 4, 1, 4, 10. See the 1, 4, 10, how many bhavas it has? Venus 1, 4, 10.
Everywhere, yeah.
Right? Yeah, Moon 1, 4, 10 is there. Mars 1, 4, 10 is there. Rahu 1, 4, 10 is there. Right? Yeah. 1, 2, 3, 4.
Correct.
And then 1, 4 partially, right? 1, 4, 1, 4. Here 1, 4.
But again, 6, right? 8, 12 in both Jupiter, Saturn, and Ketu.
Correct.
Yeah.
No. Only 6, 8, 12 in Jupiter. not in Saturn.
Oh yeah, not in Saturn, not in Saturn.
Not in Saturn, not in Mercury, or not in Ketu. Right?
Okay, only in Jupiter, yeah.
Only in Jupiter.
Yeah.
So that is what is saving her. See, remember other combination I told you, right? 1, 6, 12. What does 1, 6, 12? They keep on going to hospital.
Hospitals, yeah.
One after other.
Correct.
One or other. It need not be the same disease. It could be different one.
Correct.
So that is what you are saying with this lady, right?
Chronic disease.
Chronic. That multiple issues is coming, right?
Like she has arthritis, she has BP, diabetes, spondylitis.
Yeah, whatever, right? I mean,
yeah.
So you don't have to, right? You go through all that. See, right? This is simple.
Yeah.
Just with this calculation only, we didn't even go here. What is the Lagna? What planet is there in 6th house? What is there in 8th house?
Right.
Now, what is that in 12? We didn't see not even all that, right? Here itself, we got the answer. Now let's see here. What is there in 6th house?
Ketu.
8th.
Nothing specific.
Nothing, right? Yeah. Okay. But then a lot of 6th house, who's that?
That will be moon.
Moon, right? So moon, right? So moon is again, you have 1, 4, 10, 6, 12, all that. 5, 11, all that, right? Then 8th house. 8th lord.
8th lord is Mercury.
Mercury, right? Yeah. So again, 6, 8 negative. Not much strength he is giving.
Negative.
Right?
Yeah.
What is 12th house?
12th is Rahu. Saturn,
right? Again, we saw 6, 12, all that, Rahu. So remember, what is the natural karakatva of Rahu and Ketu?
As in
the diagnostic confusions.
Correct. Surgery.
Surgery. Ketu is for surgery.
Yeah.
Right.
But Rahu is more of confusion, inexplainable.
Confusion, right? Or one after another, this one or that one.
Correct.
All that. You can see, right, with the list of issues, the doctors also might be going through this. Okay, whether she has to be sent to this specialist or that specialist.
Yeah, exactly. Because you don't know symptoms are coming from what exactly.
Correct, exactly.
Yeah.
Exactly. So that confusion is there.
Yeah. And also depression is what I see sometimes. But
that is again moon, right? What did we say for moon?
Yeah.
6th lord is moon.
6th lord is moon. Yeah.
Right? You see that.
Yeah.
And then again we see this 6, 1, 6, 12, 1, 4, 10. All right. All that.
Yeah.
So this person, if you compare this person with this previous person, how would you rate?
This person has more issues.
More issues.
Yeah.
Right?
Yeah.
And the surviving in the sense, fighting with those diseases also hard for this person.
Correct. Yes.
In spite of that person got critical issues, but still he is able to survive.
Yeah. Exactly. Yeah.
Okay. So this person will keep getting it.
He will
see another thing. See her number of counts.
4 18 times. 4th.
4 18 times. 1 11 times.
Correct. 12 is also 11 times.
12 is also 11 times. And then 2 is again 10 times.
Oh, that reminds me, she has issues with her feet. So 12.
See?
Yeah.
She has issues with the feet. She must be having problems in the lungs, heart, that area. You said something related to lungs, right?
No, she has like arthritis and stuff, but
arthritis, something.
Lungs, I'm not sure. I should probably
Okay, check, right? Lungs or heart, anything related. Basically the chest area.
Yeah. I mean, technically, if you look at BP, it's from the, I'm not a medical professional.
No. Yeah. Now, heart, BP could be from somewhere. Okay, that's overall blood, right? It's the blood circulation.
So one is again head, right?
Head.
Head. Yeah.
I mean, again, you said, right? She has some, what is it called? Just now you said.
Depression.
Depression.
Yeah. Yeah.
Right?
Yeah. Yeah.
So now this and these planets, these bhavas, and then this one, it's all connecting. Correct. If it all connects, then it's sure there is problem. And then if you see this alone, will give even pinpointed issues. Issues, correct. Okay. So let me tell you one more example. I thought I had it in the PPT. Oh, 1 minute. Okay, 1 minute. Let me open one more chart.
But this person hasn't got any major issues till now.
Correct. So because there is no 6, 8, 12. That's what I'm trying to pull up one chart.
So that is the savior.
Yeah. Okay. Okay, see this person. Okay. So how is Ketu?
8, 12, 5, 9.
Kind of mixed.
Mixed. Yeah.
Mixed, right?
Yeah.
Venus.
Positive only.
Venus, no, 6, 12.
Oh, Venus.
Oh, sorry, Venus. Oh, sorry.
Yeah.
I moved down to Sun. Yeah.
Yeah.
Kind of, right? Yeah, positive. I mean, basically mixed, right? 5
mixed,
and 12 gets cancelled, right? So there is nothing.
Yeah.
Right? One positive and one negative.
One negative. So mixed.
Sun.
The Sun is negative.
Sun is negative, right?
Yeah.
I mean, again, 5, 9 is also, 5, 11 is there, 6, 12 is there. Both are there, right? Then this one, Moon. Negative. So this one, Mars.
Negative only because
negative
5,
one.
9 is not there, but 10,
9 is 11 is there, and 6, 12 is there. 1, 4, 10 is there.
Yeah.
Right? Negative. Rahu.
8, 12 is there. 5, 9 is also there. 1, 4, 10 is there. 10, 11 is there. Maybe mixed.
Yeah.
Yeah.
And Jupiter.
This would be positive.
5, 12. No, see, 4, 10. I mean, 4, 10 is also mixed. There, right?
Yeah.
Kind of mixed tone. We cannot say positive.
Yeah, okay? I cannot say.
Depends.
Yeah.
Right? And Saturn.
8, 12, 5, 9, 1, 4. Mixed again?
It's a little bit positive because she has full combination. 5, 9, 11.
Yeah, 5, 9, 11 is there.
9, 11 is there, but 8, 12 is there. So you cancel this goes off, this goes off, this goes off. 1, 9 will be there. Little bit positive, not too positive.
Correct.
Okay. Right? Mercury.
A positive again.
Yeah, I mean, neutral.
Neutral, yeah.
5 and 12, right? There is nothing, right?
Yeah.
So this person came to me with COVID.
Okay. Oh, okay.
So this person came to me on 26th April or something like that, or maybe on this date, 1 or 2 days. Okay. 24th April 2021. Admitted for COVID in critical condition. Okay. So then what will happen? What date is it?
24th April 21.
Yeah, 2021, right?
Yeah.
So April. Okay.
Ketu.
See, Saturn, Ketu. Saturn has 5, 9, 11, 5, 9, 11, but 8, 12 is there. Ketu, also 5, 9, 11 is there, but that is not connected. 8, 8, 8, 12 is
12
there.
is there.
Right? So I said, okay, this person
Some
will
recovery.
go through.
Yeah.
Then what did I say is from 20th April only, I mean May only, she will come out of the
COVID.
She will feel better.
Yeah, correct.
Because no 6, 8, 12, nothing, all
In
positive
Jupiter.
only, right? It is clean. Here also Rahu is 6, 8, 12 is there, 5, 9, 1, 4, 10, also all mixed. All right. Here also the same thing. Correct. So that person came like on this, somewhere around this period. Okay. So then I said only after 20th of May, this person can see improvement. Okay. So I predicted she will recover after May 20th. On 21st May, she was discharged from hospital.
Right.
Okay.
Right.
Then on 16th June, she again got admitted to hospital, to ICU. Post-COVID issues, lungs, heart, and all. See here? See number 4?
Yeah, number 4. Yeah.
Okay.
Yeah.
And then, see in the 4th house, so many planets are there.
There, yeah, that's true.
Right? Again, these planets are all weak. 4th Lord, Mercury is there, but no strength.
No strength. Yeah.
No strength, right? And then what happened? On 16th January, June, she asked whether she will survive. Okay. Basically, this person's a sister. Then she suffered. Then hospital doctor said, take her home. We cannot treat her. Sometime in July, August or something. Okay. They spent a lot of money. On 7th September, she passed away. 7th September. So basically, Venus period.
Venus period.
So,
Jupiter.
Yeah, see, here, Saturn, Venus, Rahu.
Rahu, yeah.
Okay, this period, she passed away. So basically, the thing is, right, there are no 5, 9, 11 so strongly.
Correct.
Okay, I think she had also diabetes also, I don't remember.
Yeah.
Basically, they came when she was diagnosed with COVID and all. My answer was, okay, she will recover from COVID. Okay, she will improve after 20th May. That has happened. Right? Then after that, post-COVID situation come because the chart itself is not that strong.
Correct.
Okay.
Yeah.
Okay. And then there is a commonality between this person and you.
Me?
Yeah.
Okay.
She is a twin survivor.
Oh, twin survivor. Okay. Okay. I thought the chart had a commonality, but no. Twin survivor.
Twin survivor.
Okay.
Incidentally, another commonality is on both the cases, the boys died.
Shortly after birth.
Yeah.
Okay.
Whatever.
The
other twin was a boy. Let me put that way.
Other twin, correct. Yeah. Interesting.
Interesting commonality.
Yeah.
Between both of you.
But otherwise, her health was apart from this COVID.
I think, see, based on the chart, right, doesn't show any good health at all.
Good health at all, yeah.
Some or other issues she must have been
facing. Correct.
Right? So, I don't know. They just came to me.
Only for this COVID.
For COVID, she was in ICU, right? And during that April, right? April 2021, that is the peak of Delta.
Right.
Last year.
Right.
Right?
Yeah, that was a very bad period. Yeah, very bad.
Yeah, peak of Delta was going on, right? That's why they were worried whether she will survive or not.
I know 20-something-year-olds passing away because of COVID. Well, otherwise healthy. Yeah.
There is no age at all. Right? A lot of people passed away.
Yeah.
Right? So basically, like to see whether the person will survive or not, that is where you go and check the DBA and see for 5, 9, 11. And the combination of 6, 8, 12 and all.
Correct.
Okay.
Yeah, correct. If you have a little bit of time, we can just quickly look at my chart also.
Okay, let me stop the recording then.
Yeah.